Welcome everyone to our media availability and media conference this afternoon. Some updates that we were able to provide for you and some questions from the media we'll entertain a little later on. Some reminders on closures. Again, remind you that all the play structures in the city of Hamilton are closed. Signage is going up as we speak, and we encourage you, we demand that you stay off of them because they're not sanitized and they're potentially problematic for spreading the virus. Albion Falls parking lot is closed. The golf courses are closed. The Hamilton conservation areas and parking lots are also closed. And all municipal buildings, City Hall, rec centers, and libraries, all closed, although council and council members and a lot of staff are still functioning remotely. All the usual numbers that you would use to connect with people, you should continue to use, including council members and their administrative staff, as well as my office. The Hamilton Farmers Market has been, hours have been changed somewhat, so market is to be open Tuesdays, Thursdays, and Fridays and Saturdays, but for reduced hours from 9 a.m. to 4 p.m. each day. And we are delaying the start of the spring rec programs at least for a couple of weeks, and it may be more. The leaf and yard waste collection has been suspended, so either hold on to it or take it to the transfer stations. You can deliver it there free and have it looked after that way, or you can just keep it at home until such time as collections start again. We're asking you to avoid the use of the escarpment stairs unless you're using it for transportation. Far too many people congregating on the stairs at any one time is not good for that spatial separation. And the dog parks remain open, but we ask people to maintain that spatial distance of 2 meters or 6 feet at all times. I do remind you that Earth Hour is happening on March the 28th at 8:30. We're not doing anything special other than we're dimming the Hamilton sign, and we encourage everyone at home to recognize Earth Hour from 8:30 to 9:30 as well. Dim the lights, don't use the electricity, maybe read a book at that time to just demonstrate that we can conserve energy. And continue on with the transit issues. We know that transit hours have changed. We thank everyone for their patience through this process. It is free public transit at the moment, but only for people that need public transit. So for those that are using this as some form of entertainment or joyriding, please do not do that. You're tying up the system and you're potentially either infecting yourself or others in the process of doing that. So let's leave it for the people that need it. Our first responders, police, fire, paramedics, public health, all use transit to get to work, and others. For that purpose, and maybe for groceries, for those that need to use that, please do that. But let's stay off the transit system when it isn't necessary. And some good positive announcements today from our federal government in terms of business and economic sustainability. And I think the 75% subsidy for employees is a very, very positive step on behalf of the federal government that hopefully will help businesses either bring back people they've laid off or subsidize the people that are still employed currently. That's certainly an incredible benefit, and it certainly will help a lot of small to medium-sized companies sustain themselves as they go through that process. And on that note, I'm going to turn it over to Paul Johnson to provide any additional updates from the Emergency Operations Center, and then over to Dr. Bart Harvey, Medical Officer of Health, to update us on any medical public health issues. Paul?
Thanks very much, Mr. Mayor. A couple of things. Two things that are dominating discussions within our Emergency Operations Center are obviously the length of time that we'll be in some kind of a closure, a major closure of all of our facilities and activities. And I can tell you that we're very much waiting to align our discussions with what's happening provincially. Those announcements have not been made as of 3:34 on Friday afternoon. So we'll be waiting a bit on that. But to that end, the mayor's mentioned some of the decisions we've made about pushing out some of the start potentially for rec programming. We've also revoked our SEAT applications, which are our special event permits for activities happening in April and May. I use the term revoked because many have canceled, but we're pulling those at the moment anticipating that we'll be not having events happen through April and May. But if for some reason something should occur, those groups could easily reapply and we'd have all of the information available to move forward. So if you were planning events in April and May, obviously we're not taking new applications. We are going to start revoking some of those that are happening in April and May. And you may also see some additional cancellations of events that were planned in the community. It's a balancing act for those events where we would start to spend money or energy or staff time planning those in advance. Many of those are choosing to be canceled for 2020, and our website will have a listing of those. So I understand the concern from the community. When will life get back more to normal in terms of visiting programs and facilities? But we're just going to have to wait a little bit longer, and next week we'll have some further announcements about that. The second thing that we hear a lot of is concern about whether we should further close public access spaces to reduce people's ability to be out in the community and potentially, of course, then be in too close a proximity. We are really trying to balance within this community, as all communities are, our need to do certain things, which include recreating and being outside and getting some fresh air, with obviously our attempts to slow the progression and certainly the spiking of COVID-19 in our community. And that is a delicate balance. And so parks and other things are open for use. I know I've received many photos of people out and saying, well, there's a lot of people on this trail or pathway, or there's 30 or 40 people in a park. And the reality is we need to ensure that we're following all these messages. Go out if you absolutely need to. If not, stay close to home. When you go out, it is about physical distancing, that 1 to 2 meters. It is about hand hygiene. It is about not touching your face. If you're sick, don't go out. And if you see people who are sick, avoid them. Those are the kinds of things that we're looking at. And certainly if you're sick and you haven't been in contact with a healthcare provider or public health, then we encourage you to use all the numbers that we've been publicizing in order to get in touch with somebody. And so the balance we're taking at the Emergency Operations Center is we're closing those things that naturally would attract people to gather together and congregate in too close a space, but also keeping some availability there in the community for people to get out. And then when the mayor talked about the dog park, there's a prime example of that. We're reminding people at our dog parks through signage about the need to be physically separate. But we understand that dogs need to get out, and dog parks are a great place for people to take their dogs and get their dogs out as well as themselves. So it is always that balance that we're striking. And we appreciate that many people are fearful of large gatherings and large amounts of people. But I'd also encourage, if people see areas with large amount of people and don't feel comfortable being there, then go somewhere else or leave that area. I think it's up to all of us to work through this social distancing, as they call it, or more recently we've been talking about it as physical separation. So we thank the public for their patience in terms of that element of it. It's not something that our role is to enforce that all over the city. We are doing some enforcement of certain activities related to business or structured gatherings, but it's up to the rest of us to hold each other accountable for the other elements that we've been hearing both federally, provincially, and through our own local public health unit. So I know Bart Harvey has some information not only about cases in our community, and I'll turn things over to him about that, but we have been working hand in glove with both Dr. Harvey and Dr. Richardson about some of this balanced messaging about community activities. And why I wanted to spend just a couple minutes there is that it's that line between what is good public health guidance for our community and also the operations of facilities and outdoor space. And we're all trying to walk that line together. And I really appreciate the help that Dr. Harvey and Dr. Richardson have provided in terms of our messaging and our approach to those types of opportunities. So over to you, Dr. Harvey.
Thank you, Mr. Johnson and Mr. Mayor. So good afternoon, everyone. I think on our website, again, that's available at hamilton.ca, coronavirus, and we're updating on a daily basis the number of cases, plus some demographic information about the cases. We're now up to 50 cases in Hamilton, so that's an increase of 7 since it was announced yesterday. I will reiterate what both Paul and the mayor have said, that it's really that 6-foot safety zone. Protect your own and respect others. This virus is not an Olympian. It can't jump further than 2 meters, 6 feet. So as long as you're outside of that zone, that virus, even if you're talking to an infected individual that's that far away, they cannot infect you. It looks like it's going to be a great weekend. I would underline what Paul has alluded to. We need to take care of our mental health and our physical health. So go out, have a walk, have a run, have a bike ride, walk your dog, but remember the 6-foot safety zone. The other way this virus transmits is through contact. We know that it can survive, in the ideal circumstance, up to 9 days. So disinfecting surfaces, certainly trying to avoid surfaces. Any frequently used surfaces, clean those, avoid those, and again, washing your hands. We've also started to see some of our earlier cases now be resolved, so deemed clear. So these are the rare folks in our community now that I'm pretty confident of saying are now immune to this virus. So they've gotten it, they've fought it off, they have immunity, so they've started to contribute to our community's resilience and immunity against this virus. And over time, we will grow both individually and as a community to become more immune to and protected against this virus, but that's going to take others to be infected. Again, what we want to do is we want to try to elongate and flatten that curve of cases. As Paul alluded to, we want to avoid the spike because our colleagues in the healthcare system, they have finite resources and finite numbers of them. They can provide support and care to a finite number of individuals when they become ill, especially those that become severely ill. So we're trying to avoid what I fear that our colleagues in Italy are experiencing, where they had a tsunami of severely ill individuals all crash against their healthcare system, and they weren't able to do it. So that's why protecting your 6 feet safety zone, maintaining physical distancing, and we don't want social distancing. Hamilton is a caring community. We want to keep caring for one another, supporting one another. So we want to maximize sociality, but we want to do it at a 6-foot distance. The one other thing I'll comment on is those 7 new cases, as I alluded to yesterday. Most of those appear to be community spread, no link to travel, no link to an obvious contact. Of course, our staff are in the early stages of investigating those, but as I mentioned yesterday, I think we're into what I view as being kind of the 3rd phase. We've gone through travel, we've gone through contact, we're still seeing some of those, but the majority of cases now are going to be like influenza that joins us every year and we live through every year and be spread in the community, and people aren't really going to know where they contracted the virus. I'll stop there, and we'll see if members of the Fifth Estate have questions for us.
Okay, thank you to all of our speakers. We do have some media partners on the line today. We're going to start with Joanna Furketich from The Spectator.
Hi, thanks. My question is for Dr. Harvey. Can you please talk about the case with the employee of the Hamilton Wentworth Detention Center and why that hasn't been made public yet?
Hi, Joanna. Well, if it hasn't been made public, certainly a lot of people know about it. So it's certainly not a unique circumstance. It is to the detention center, but we've certainly had lots of other employers across the city and elsewhere that have had an employee test positive for COVID-19. Our staff over the last couple of days have been working very closely with the detention center and their provincial counterparts in doing what we do, is identifying over that time period, which is now 48 hours before they became symptomatic, identifying which of their coworkers, which of the inmates, which of their family members would have been close contacts, asking them to self-isolate themselves so that if by chance they got infected with the virus, Hopefully we have them sufficiently isolated enough so that when they become symptomatic, or even for the 48 hours prior to symptomatic, they don't have the opportunity to transmit the virus to others, because as people will recall, and I'll keep repeating, our main job here is to, as best we can, eliminate or reduce the risk of this virus having the opportunity to go from one person to another. So we're in the midst of doing that and working with the detention center in reducing that risk of transmission and moving forward from there.
I appreciate the answer, but I mean, I think there's a difference between the jail and other employers. I mean, you're talking about a very overcrowded provincial jail, and there's quite a time lag between when this person was put into isolation on the 20th, when the Minister of the Solicitor General was told on the 24th, and then when test results came back on the 25th. I mean, can you talk about some of these time lags? Like, why did it take so long to tell the Solicitor General? Is there no way to expedite a test for an employee who's working in a provincial jail where, you know, there's a lot of crowding, just, you know, where the person has contact with inmates and staff?
Sure. No, great points. And I fully agree with you, Joanna, that the detention center and all detention centers and prisons across Ontario have been identified prior to COVID-19 as being vulnerable populations. That would go along with all of our long-term care centers and the staff that serve them and the residents that live there, as well as our shelter health, precariously housed individuals. All of those are key vulnerable populations that we're very sensitive to. I think part of the issue here is for individuals who already knew that they were a contact of a case, they'd already been alerted. Be astute to your symptoms. If you become symptomatic, please identify to your employer, to public health, to your family doctor, so that we can have you assessed and have you tested. Or if you've had international travel, self-isolate. Let us know if you're... The challenge with community transmission is that people have to get to the point where they're totally aware that that something different is going on and that they need to seek a healthcare assessment. Certainly in retrospect, you could say, geez, why did they wait so long? Again, I don't know the details. My understanding from our staff was that any of the initial symptoms were really quite mild, and in fact, there may have been 100 people in the city that had similar symptoms, and 24 hours later, they totally cleared up and the person just kept going along. So I think part of that is that, but certainly we don't have any concerns that the timing within which public health was made aware, and I will point out that, you know, in some instances, people that work in Hamilton don't live in Hamilton. So we would not be if it was somebody that lived somewhere else, we would not be the first health unit notified. It would be the health unit where this individual lives. And then that health unit would turn around recognizing that there's contact with an employer or a place of work that's in another jurisdiction, and we will then bring that other jurisdiction, notify them, and then, as we're doing now, working with this workplace and this employer that's based in Hamilton.
Thank you, Dr. Harvey, and thank you, Joanna, for your questions. Next, we have Katrina Clark from the Hamilton Spectator.
Hi, sorry. My question is regarding use of public space. I'm wondering what it would take for the city to close trails and public parks.
So I think closing areas would be if there absolutely positively were gatherings that were occurring that somehow that area was attracting that we simply couldn't keep on top of in terms of breaking up. So, I suppose there's a threshold of numbers, but I have no idea what that might become. Right now, we're quite comfortable that even some of the photos I've seen, people seem to be respecting that 1 to 2 meter rule. If people were gathering, if this became picnicking, if this became barbecuing, if this became camping, because some campsites are closed, I suppose those are the incidences where we would do something differently, because that's about gatherings. And that's really what we're trying to shut down. And if you listen to Dr. Harvey and others, this is about getting out and being physical. It's about moving somewhere, whether you're riding, striding, rolling, walking, or running. And as long as that's what's happening, I think we're comfortable at the moment that it's occurring. I think for us, what we're monitoring is when it becomes gatherings, and these seem to become more social outings where people are gathering together in groups. That might be something that would concern us, but to date, that's not been a huge issue.
Thank you. And
Katrina,
you mentioned as well.
Sorry, Katrina,
Oh, yeah.
can I jump in? So,
Of course.
If I may, I'll use an example. Let's talk about the escarpment stairs. I think it's been a bit of a flashpoint, understandably. So I love the escarpment stairs personally, and I guess my advice would be, we'll keep them open as long as people are demonstrating that when they're using it, they're maintaining that 6-foot safety zone. But as soon as we see people stopping and being within 6 feet, then I think to some degree we're going to be left with no option than to close the stairs, which I would really, personally and professionally, not like us to see. But it means that users of the stairs need to recognize, if you're a team, then you stay 6 feet apart from one another while you're running up and running down the stairs. Certainly we recognize some people go up, some people go down, and that momentary kind of passing going up and down, I'm fine with, as long as it's continuing up and down. So I think for me that's is kind of an illustrative point around your question, is as long as people are maintaining that 6-foot safety zone and that distancing from one another, I think we're okay. As soon as we see, as Paul has alluded to and the mayor has alluded to, as soon as we see that people can't do that, then we're going to be left with no other option than to start closing these wonderful resources, essentially for health issues, because, people aren't leaving us any other option, and quite frankly, we'd like to leave them open.
Thank you. My other question, so there's mention that people are sending in photos of people gathering in groups. Is the city doing anything when it receives those photos? Are there any plans to enforce physical distancing in any areas, say like the stairs?
No. While it's coming in, I illustrate that to say we know that this is of big interest to the public, and whether it's through official channels or people just tweeting it out, we're seeing them. So that was more to illustrate it. It's not something that we're there to enforce. We're monitoring. These are our assets as well. So we're parks and things, we're out there, we see what goes on in them. So we're looking at that, and we'll continue to evaluate if we see some of these activities happening that cause us some concern, and we'll work with public health around that. But it's also important to note that to close, so we could use the stairs as an example, and there might be ways that you could close that. But when you're talking about parks, when you're talking about certain walkway areas, the physical infrastructure that you would need to actually close those off would be beyond what we should be doing. I mean, these are very porous areas. They're in neighborhoods. People can walk through them. We'd have to erect fences around all of them, and I'm sure that's not what we want to do, nor is it the kind of resource that we want to expend. So that's some of what we're seeing, and I think we all just need to take it upon ourselves to limit. So if you see a certain area you like to go and it's getting pretty busy, then go somewhere else. I have to say, last night, and it's the first time I've done this in 2 weeks, I went out and I walked around in my neighborhood. I happen to live near Valley Park. I saw the grand total of 4 people walking through Valley Park. So there are areas of the city where there aren't large numbers of people gathering, and they're great park areas to go. Now, that doesn't mean the whole city needs to come to Valley Park tonight, but it does mean that there are places where you can go and walk and be lots of distance apart. And it was a great little walk around the block for me to get outside, and I think that's what we're encouraging everybody to do. This is a collective effort, not an enforcement, licensing, bylaw, policing effort. There just simply isn't a way for us to do that.
Thank you both, and thank you, Katrina, for your questions. I just wanted to mention as well, we are aware that we are having some technical difficulties with our camera angles, so we are looking into fixing that. Next question is from Jennifer LaGrassa with CBC Hamilton.
Hi. So my first question is for Dr. Harvey. What is the detention center doing to ensure COVID-19 doesn't spread inside the facility other than isolating people?
Hey, Jennifer. Well, so this virus is a pretty crafty little guy, so that we've learned, and there is no magic bullet. If there was a magic bullet, we'd already be using it. So we're using all of the techniques that we've used for decades and decades in public health with respiratory viruses that get spread kind of over this limited frame. So as I outlined with Joanna earlier in my answer to her, is working with the detention center, working with their management and their staff, identifying who's been in close contact, having them be self-isolated. Certainly the usual cleaning processes undoubtedly have been increased. So can I guarantee that this virus won't spread further through the detention center? Absolutely not. If I guaranteed you that, the mayor should fire me, because we can't do that. We're doing the best we can to try to, as I said earlier, minimize the probability, the opportunity of this virus being able to transmit from one person to another. Certainly from an additional, like the co-workers, us being able to identify them now, get them into self-isolation. We're hoping that ideally we can eliminate the opportunity that they have a chance to spread this virus. So it's really trying to contain the virus and minimize its opportunities to transmit from one person to another.
Thank you. And my second question, how is protective equipment being rationed in the city?
So one of the early decisions we made in the Emergency Operations Center was to centralize our supplies, and that includes some of the PPE. We also have a logistics and procurement section within the EOC that is scouring many different places to bolster our stocks. So we do two things on a daily basis. We monitor the supplies of all types of supplies, so both supplies, and those would be hand sanitizers, wipes, cleaning products, those types of things, as well as what would more be defined as PPE. So we have a good sense of what that is. We're checking in with the operational divisions on a regular basis for what they need. We do have protocols in place in terms of who uses what, and the example I'll use is EMS and fire and long-term care have really detailed examples of when they use certain materials and in what circumstances they're following those guidelines, be they directed by the province or their own operating guidelines. So we are continuing to work with that. I would say to you, because I think it was in your question, we are not rationing PPE. We're using it under the guidelines that people have in place. We have supplies that we need at this stage, and we continue to source those supplies. It is certainly a question that's on everybody's mind as this curve continues to increase, is how we make sure we have the right supplies on hand. But we have not had to undertake any kind of rationing of PPE at the City of Hamilton to date. We have those stores in place, we monitor them daily, and we are actually procuring as we speak more supplies to have on hand.
Thank you both. Next question is from Matthew Van Dongen with the Hamilton Spectator.
Hi, folks. Thanks for helping us out. I was wondering, I think it was either Mayor Fred or Paul who had brought up the idea that you had noticed some people trying to take advantage of the changes in services over the last couple of weeks by, going ahead with building without a permit and things like that. Can you give me a little bit more detail about what you're seeing and how often?
So I don't have information about how often. I think I use that as an illustrative example to say this isn't a suspension of all rules at the City of Hamilton. In minor cases, there are things that we are not taking the same enforcement with, and they are few and far between. So the one that I did talk about was, for instance, metered parking and some surface lot parking in terms of payment, and that's just because we've kept a lot of our non-essential staff out of the community. But we are enforcing, and let me be very clear, you cannot build in this community without a building permit. You cannot do the major types of activity without the proper licenses or permits or approvals from the City of Hamilton. And all of those functions are available, many of them online, or if you connect with us through the usual contacts, we will tell you about any service delivery changes that occur. So at this stage, Matthew, I can't tell you about the volume of it. I think what we want to do is send out very clear and strong messaging to the community that it's unacceptable, and ultimately, we will get back to a more fulsome enforcement of it, and then there's going to be challenges for people that have gone ahead without the proper permits. So the best thing to do is to follow the proper processes, even though we're in this different circumstances of how we're delivering those services.
Okay. And a related follow-up on that then, I had heard from a lady out in Binbrook about some illegal dumping that had been happening, soil dumping. And she had mentioned that when she called the main number, it just said that we would be reopening in April. She didn't classify it as an emergency, so she didn't call the emergency number. But what should people be doing in those instances? And are you going to get the same sort of level of response to a complaint like that, or is that something that's kind of considered less critical?
So certainly, I'll take the first part, which is we are seeing an increase in illegal dumping of a variety of things that are going on, and more from a household garbage perspective, Matthew. And it was actually one of the reasons why we made the move to change operations just slightly in terms of not taking cash, but opening up the transfer stations, because we saw a corresponding increase over those few days they were closed in some illegal dumping in the city. I would say that if normal numbers that people call have messages that say we're closed, the other piece that's always available to people is 546 City. So I think if people are concerned about it and may say, well, it's not an emergency, but phone 546 City, our customer contact center is open, and they can help redirect the call, because granted, there may be some automated messages on certain numbers that say essentially no one's there to answer that phone, but our customer contact center has been open throughout this crisis. They've been doing a wonderful job. Their call volume is at fairly consistent levels with normal courses of business, so you won't stay on hold for too long. 546 City, talk to the operators there, and then they can redirect you to folks that could manage that, because we do want to nip some of these things in the bud and not have too much of this activity. We do have people that can enforce and be sent out in certain circumstances. So a great purposeful announcement to the community to remember that 546 City is there at your disposal.
Thank you, Paul, and thank you, Matthew, for the questions. Next we have, and finally, Tevi Amaro from the Hamilton Spectator.
Hi, thanks for having me. Just a bit of a follow-up maybe for Paul Johnson. Paul, you mentioned the other day that the city had X number of dollars that would flow to residential care facilities, so not nursing homes, but the residential care facilities. I was wondering if you could speak a little bit in more detail about when that funding will flow, what the city is trying to do to help out the facilities, and in relating to this too, is there an option for, should there be a case in one of those residential care facilities, is there an option for people to self-isolate, as is the case, I think, for shelters, for example?
So we are in pretty regular contact with some of the leadership structure within the residential care facility system. So those conversations, and quite frankly, some of the initiatives we've taken have come out of those conversations. So the money, my understanding is we've made the commitment. I don't know exactly when that money would flow, but the commitment is there. So I assume it's in their normal billing cycle that we'd simply be providing that to the home, so they know that it's approved, so they can understand that that income would flow and that revenue would flow to them in their next cycle. The kinds of things we're looking at is they've suggested to us, and because they've changed their operations, they have increased staffing costs, increased cleaning costs. One of the things, for instance, some of the larger residential care facilities are having meals done in 2 or 3 shifts so that not everybody is in the dining area at the same time to maintain that kind of physical distancing. So recognizing there's some increased costs for some of those, for some of the larger homes. Certainly, I know there have been conversations about how people would isolate with individuals who are experiencing symptoms, because not all rooms in residential care facilities are private rooms. So I know that some of that work is underway, and that our folks also would be able to step in. Again, as I mentioned on one of these briefings a few days ago, we have quite a number of hotels, spaces that are available to us. In sum total, it's about 400 that would be available to us if we absolutely needed it. And so we would be able to quickly move, and we've got transportation lined up so that we can do that safely for all involved in the community, working in partnership with public health to set that up. So we're I think, covered, Tevye, for that. And the other thing we do is just have these constant calls to see what's changing. And should we see some cases emerge or COVID positive individuals within, whether it's the RCF system, whether it's long-term care, whether it's the shelter system, we're ready with the plans as a community to make that happen, and continuing to evaluate what investments we should make in order to keep the workers in those organizations safe, and also keep those who call them home safe as well.
Thanks, Paul. I guess as a two-pronged follow-up, which is kind of cheating a bit. I remember you mentioned the dollar figure, and I can't remember that, and you phrased it as base funding. So I just wanted to be sure that whatever that dollar figure is, if you could repeat it, that it's over and above what the city is already giving residential care facilities. And the other part of my follow-up is, has public health and city advised some of these programs that, I don't know, churches and offer people who are experiencing homelessness, food on the street, like in Ferguson Station? Has the city advised them not to do that anymore outside?
So the first question is the total figure of this initial investment is just over $300,000. I'm thinking it's $310,000, but I do have a lot of numbers running around my head, but it was just over $300,000. And when I say it's base funding, we've created a formula depending on the size of the facilities, and that will be a lump sum payment in addition to whatever the billings are that normally come in. So this is additional investment money. It's COVID-19 related investments to cover off some of those increased expenses. And I know some of the feedback is, we need more, and we're continuing to listen to what those needs are, but also balance out that the RCF system is varied across the city, some very small homes, some very large homes. So we're trying to take an approach that works for all, and then check back in to make sure that we don't have any challenges. And the second piece, Tevye, just remind me where you wanted to head with that.
Oh, I'm sorry. I'm just wondering if, for example, some of the programs at churches.
Oh, churches and that. So we have had a variety of outreach. As you know, places of worship are closed, so some programs were impacted by the fact that they are closed. I'm not so sure it's advising not to do or to do something, but there are some people that are coming out saying we can help with your overall delivery of service in the community, and where appropriate, we are feeding that into the system. We do need places to help us with food and other activities, so we have had a number of groups step forward and say we're willing to help. And I think as you see the next week and the weeks to come progress, that we'll have more of these local, either faith-based or very small charitable activities continuing in the city. And when they connect with us, we also ensure that they're done in a safe way. But in terms of a blanket, yes, no, I don't believe that's gone out. But to be honest, a lot of the places, if they were happening in the community, those spaces have been closed to the public under some of the orders that have come down provincially.
Gotcha. Thank you very much.
Thank you, Paul. Thank you, everyone. Thank you to our media partners for calling in today. And I'd like to turn it back over to Mayor Eisenberger for some final comments.
Yes, thank you. And thank you to the media, and thank you everyone for tuning in. Again, a special thank you to our American Sign Language interpreter, Rosalie Vissers and Georgia Whalen, for a fantastic job. And I do want to remind the community that this is not the time to relax. This is not over. It's expected to get worse before it gets better. I think everyone that I've spoken to, both federally, provincially, and locally, thinks that we are going to see more cases of this, but we need to continue to do what you're doing now, which is maintain that spatial separation, physical distancing, and don't form in groups, and stay home as much as humanly possible. It's critical. April the 6th seems to be a date that everyone's focused on. I would say that there might be an expectation that this is going to go longer than that, so prepare yourself and continue to do what you're doing. And I would say, by and large, the community as a whole is actually doing what we are asking them to do. Your part is to stay home as much as possible, wash your hands, clean your surfaces, don't engage with your family that is not living with you at this moment in time. Don't have a party, don't have a pickup game of football or basketball. Stay home as much as humanly possible, and we can all help to plank, crush, or whatever terminology you use, flatten out that curve so that we don't overwhelm the healthcare system. So thank you for your efforts. Keep doing it. And for those that are not, you're not immune from this, and you are a carrier. So assume that you have the potential of affecting someone else. And if you think about that and think about what you might take home and give to your kids or your parents or your grandparents, for some people, it could be a life-threatening issue. So stay clean, stay safe, stay apart, and keep doing what you're doing. And thank you for all of your effort.